provide to you this discussion entitled Free NCLEX Review Series for International Students. Since our presentation will be for all international students, we are expecting that there will be participants in different locations. So welcome to all of you who are watching us live via the Facebook page of IPASS Honor Review and Mentoring Academy and UWorld Nursing, and also in the YouTube channel of UWorld Nursing. So with that, I'd like to know where your current location is. Are you currently in the Philippines, or are you in Europe? Are you in the Middle East? We'll be able to see your comments here in our studio. So please feel free to comment where your location is so that we know where are you watching us from. So IPASS Honor Review and Mentoring Academy and UWorld have come up with this collaborative initiative because as service providers for the next generation NCLEX preparation, we want to share our expertise with you to help you ace your examination. That's definitely our goal here in providing to you this discussion. I'm seeing Lifestyle by Anne, who is watching us from Thailand. Madalena from Toronto, Canada. What's the time they are in Toronto, Canada? Blessing Fortune from Ghana. A lot of our viewers are with us already. So please help us also share this Facebook Live discussion through your Facebook wall. Make it public so that your friends and colleagues will be able as well to benefit from this discussion. I'm seeing Jeep from Vancouver, Ayo Vitalis from Scotland, Miraflor Fajardo, US, Nasim Hagilat from Toronto, Canada as well. Thank you so much to all our students, our existing students in the IPASS Honor Review and Mentoring Academy. Good evening to all of you and to all our students out there who are located also outside of the Philippines. Good morning, good evening, and good afternoon. And to all followers of UWorld Nursing, good day to everyone. I'm seeing Aubrey as well from Toronto, Hernan, Pilipinosas, one of my friends from and one of our students in the Philippines. Good evening there, Hernan. Sarah is from Ghana. Keep your comments coming. We'll be able to recognize and acknowledge your presence later on. I'm Rachel Olivar. I am the CEO and president of IPASS Honor Review and Mentoring Academy and IPASS Processing. I am the co-founder of IPASS Honor Review and Mentoring Academy. And with me tonight as well are our student success team from the IPASS Honor Review and Mentoring Academy. I'm seeing a lot of our viewers coming from Nigeria, from Ghana. Thank you so much for your time, and thank you for being with us on this discussion. So allow me to present to you our presenters for this discussion. First off is Sir Jay Padong, who is my co-founder in the IPASS Honor Review and Mentoring Academy. He will be presenting the overview about the next generation NCLEX. Jay, as you know, he is currently working as a charge nurse in a med-surg telemetry unit in one of the hospitals in Texas. And I'm very proud to say that a lot of our educators, mostly our educators are US-based. And Jay is our lead educator in the academy and has been an educator for most of his 20 years as a nurse. Teaching is his passion and his calling, combined with clinical expertise as he is currently pursuing his advanced nursing practice. Who among you here who is planning to have that A&P later on once you're already there in the USA? Another student success team with us is Paula Ong Alvos as well, who is also currently a nurse in Texas. She also does her charge nurse role in a med-surg telemetry unit, and she will be discussing key study scenarios which will be strategized by Miss Jamie Robbins Cruz. Jamie is a registered nurse in a pediatric surgical trauma in transplant unit in Nashville, Tennessee. She has been practicing as a nurse in the USA for 2 years now. Coming from our audience, I see the comment coming from Bright, who is watching us from London. Ivy is from Ghana, and Oliyed is from Nigeria. So thank you very much for your time. I know that your time is precious, and being with here with us here in this discussion is really a great opportunity for you as well to know what do you need to know about the next generation NCLEX. So, may I call on our first presenter, Sir Jay Padong, our co-founder in the IPASS Honor Review and Mentoring Academy. Jay, over to you.
Thank you for coming today. And yeah, I am very hopeful that I can give our nurses an informative discussion tonight. Brief information, but with great relevance, of course. And I would like to greet our international nurses across the globe, the Philippines, of course, and the rest of Asia, India, the Middle East, Europe, and here in the United States. To start with, the traditional role of clinical nurses is rapidly changing, primarily due to more complex clinical conditions and the advancement in the overall healthcare system, the nursing system, including, right? So, therefore, we must find our impetus for change to level up for sure. So, the NCSBN changed the NCLEX from traditional to the NGN. The NGN, or the next generation NCLEX, is the new norm that establishes an expectation that new nurses must really keep up because sadly we are lagging behind. So NGN was developed to better test your clinical judgment as compared to the traditional type. So it started this year, April 1 of 2023, and I like it personally because the figures are way higher than it used to. Oh yes, it's higher. That could mean you grab the opportunity to take it before NCSBN change into a more, challenging one. So without further ado, we are going to be giving you the NGN in a nutshell and some other stuff that you need to remember before sitting for your exam. Okay, so you know what, nurses? I pretty much know that you'll be able to get through this challenging journey. I want you to build the concept of manifesting or claiming. Well, you must embrace some uncertainties during your preparation because it's challenging and eventually enjoy the beauty of becoming USRN. All right, so what is NGN? So let me move to my slides, okay? So what is NGN? So NGN is next generation NCLEX. So for me, in my opinion, I call it, a new generation NCLEX because the generation is already here. You are the new generation of nurses. You are the new breed of nurses that comes here in the US and practice as a clinical nurse at the bedside of your patient with, safe and sound in terms of, clinical judgment. So next generation NCLEX is actually a test, like I told you earlier. It's a test for clinical judgment. It's a way improve, clinical judgment kind of testing. It will test your clinical judgment better. Okay. So why change? So nursing is becoming more challenging than ever with new technologies and new treatments available and more complex diseases. We just simply need to keep up. Okay, we have to keep up because there's lots of complex diseases nowadays. At the same time, the nursing system, the overall healthcare system is really very complex. It's kind of hard to keep up really. Okay, so if you were to, for example, if you were to move a certain nurse back in the days, or let's say back in the 90s or 20 or 30 years back, if you were going to move them from the past to the current times, I guess they're gonna have hard time keeping up with the complexities nowadays. So that's my simple explanation on, being the traditional and the next generation NCLEX. Okay. So, how important is clinical judgment? So, NGN is just simply basically about, clinical judgment. The Journal of Nursing Management said 65% of entry level nurses, errors were related to clinical decision making. That's a big number, 65%. Okay. So, 65%, like I said, is, of these entry level nurses, errors were related to clinical decision making. That's according to Journal of Nursing Management. On the other hand, the entry level nurses must exercise clinical judgment in up to 46% of all the tasks and must use problem solving and critical thinking skills for 30% of the task. Okay, so that's according to NCSB, and this is the very reason why they change, the manner or the method of asking you guys in your NCLEX RN. So from the traditional into the next generation NCLEX. I told you it's a new generation of NCLEX already. Okay, So what has changed then? So NCSBN, there are three things. So NCSBN, Clinical Judgment Measurement Model, or NCJMM, was implemented by the NCSBN, or the Nursing Council for State Board of Nursing in the US. Okay, so the highlight of this model are the case studies, which are divided into three different parts: the unfolding case studies, the standalone, and the bow tie. Unfolding case studies comes in three parts, I mean, six parts. Okay, so those parts are based on the NCSBN clinical judgment measurement model. Okay, for example, they're going to ask you the first part, they're going to ask you about recognizing cues. How are you going to recognize the cues? What's your skill in terms of recognizing the cues? What's more important and what is not? Unfolding. So the first part is recognizing cues down to your evaluation of outcomes. It's simply your nursing process. Okay? So they just broke it down into a more simpler form in order for them to assess you specifically on those particular, aspects of care to your patients. Okay? So six parts of this unfolding case studies. They said they're going to give you a minimum of 3 case studies. Okay? Of unfolding case studies and maximum of 5. The thing is, you will never know among those 5. For example, you'll be given 5 case studies, unfolding case studies. You will never know what are those 3 case studies that will be graded. And this is a big thing. This is a highlight of your NGN. You know why? Because in each part, for example, recognizing cues, it could be 3 points or it could be 5 points. So they're going to get a lot of points from each part of your case study or the unfolding case study. Say, for example, the first part is recognizing cues, 5 points. And down to your prioritizing hypothesis, down until your evaluation of outcomes. So that's a lot. That's 30 points if you're going to consider if it's 5 points each. So that's a lot. And how much more if you'll be given 5 case studies? But like I said, only unfolding case studies are graded. Okay, the other type of case study is standalone. There is no parts of it. It's only one question, but still based on a case scenario. Okay? And the last one is bow tie. It looks like literally like a bow tie. In the middle, you're going to be asked about which diagnosis, what is the problem of the patient medically, what's the medical condition, and the other parts of the bow tie, they're going to ask you what's the intervention and what are the diagnostic interventions. So they can ask you many things about that certain condition, which is in the middle. So it takes a lot of points as well. So you have to be really good in answering these questions. Okay? So those are the 3 types. The unfolding, which has a 6 parts, point system still, standalone, which has only one question, but still with a case study, and bow tie. Okay, so it's again another point system. So you really have to be really good in answering these questions. Second change, you're still gonna get your traditional types. For example, your multiple choice and the SARA. Okay, so plus the NGN types. So again, like I told you, the case studies as the highlight of your next generation NCLEX. Okay, so the third one is the partial scoring. They've been asking about this. Students have been asking about this, the point system. Okay, you're gonna get a point. For example, if it's a 5 point item, you're going to get like 3 points, 4 points, or as much as possible, you have to be perfect. Okay, so one is too many for NCLEX. As much as possible, you get it, done perfectly. Okay, you don't want to miss anything in your NCLEX. One is just simply crucial to to your results. Okay, so these are the 3 things that has changed, the major things that has changed. Okay, let me move on. So this is what I'm talking about, the NCSBN, NCJMM. If you look at it, there are 2 illustrations. The 6 functions of your clinical judgment, and at the bottom is your nursing process. I told you, the clinical judgment model is just simply your nursing process. They just broke it down to recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking actions, evaluation of outcomes. The conventional way, our nursing process is your assessment, analysis, planning, implementation, and evaluation. They broke it down to a more specific ones. For example, recognizing cues down to your evaluation of outcomes. for them to check you specifically on your skill regarding recognizing cues, on how you analyze the cues. Again, prioritizing hypothesis. This is all about prioritizing as well, and how you generate solutions from the start, from recognizing cues down to your taking actions and evaluation of outcomes, nursing process. Okay, this is our nursing practice basically. Okay, so they're gonna test you on those particular clinical judgment model, each part, your skill on that. So NTN, NCLEX is critical thinking. Okay, critical thinking. So we're gonna differentiate between what is critical thinking and what is clinical judgment. What are the difference between the two? They are actually consistent to each other. Critical thinking first before you arrive into a more sound and safe clinical judgment. So critical thinking. Question is there any way to build up your critical thinking in a very short span of time while preparing your NCLEX? It's a skill, like I said. Okay, is there any way to build it up? Yes, for sure. As long as you are persevering enough, as long as your knowledge is adequate, as long as you have all the necessary things during your preparation. Our ideal preparation, what we recommend is 6 months preparation. If you are going to prepare as an international nurse, okay, as an international nurse, if you're going to prepare for like 1 month, you're gonna have hard time, keeping up with the concepts and everything. This is also a concept building kind of preparation. Okay, if you're going to, take it in 3 months, that's okay, but you have to double time. Okay, if you're going to take it 6 months, that's the ideal. All right, because after 6 months, for example, like 7 months or 8 months until 1 year, preparation after 6 months is going to wane off. The knowledge will wane off. Okay, so repetition is also the key. That's one way to master your concepts as well. So is there any way to build up your critical thinking in just a very short span of time? Yes, the answer is very big yes. Okay, so let me move on. So critical thinking, what is really critical thinking? So technically, a critical thinking is a process of solving problems of patients and creative decision making. Creative decision making to effectively deliver safe nursing care. That's basically clinical judgment. Like I said, critical thinking first, which is backed up by knowledge, in order for you to deliver a safe nursing care, or the clinical judgment. Okay, a sound clinical judgment, it's not because of your safety, not only because of your safety, ultimately the safety of your patient. That's what we want here. Because again, we don't want that to happen, the 65% errors from the entry level nurses happen again. We don't want that. We wanted to decrease that figures, because again, ultimately the receiving end are your patients. Okay, and the US is kind of really, you are really having some complex really disorders. For example, before, I can only take care of like hypertension and diabetes, that's it. Before, I was a graduate of like the early 2000, so I can only take care of these two disorders on the same patient. But nowadays, name it, you have it: hypertension, AFib, CHF, COPD, asthma, and everything, cardiomyopathy. All right, so that's how complex the disorders nowadays. So again, we really have to keep up because we're lagging behind, especially for the entry level nurses. Okay, let me move on. So components of critical thinking, I highlighted your prioritization. Prioritization is really important. You know what? Testing your, NCLEX testing is really about prioritization. Okay, it's really about prioritization. Problem recognition as well, because you will never prioritize a certain, task if you are not able to recognize what's really the problem of your patient. Okay, so prioritization, clinical decision making, clinical implementation, and evaluation. Critical thinking, clinical judgment are all consistent with what you are doing. And what you're doing is basically your nursing process. They all come together. They are all coherent to each other. Okay? So NCSBN is basically testing you with your critical thinking skills through case studies as the highlights. Okay, and yeah, they especially for your unfolding ones, which has a 6 parts, and there's lots of points involved on it, and you can never go back. Okay, this is another thing that you need to know. If you're going to answer, for example, about recognizing cues, and then you click the submit button, and then you go to the other parts, you can never go back to the recognizing cues. I figured out that this is, okay, this is a myocardial infarction. This is ST elevation MI. But again, you can never go back to the first one. Okay, that's why from the first time that you encounter that question about recognizing cues, you are able to gather the information already, the techniques and everything, what is really all about. You already have your rule out diagnosis by that time, the very first, part before you proceed with the other parts of your clinical judgment model. Again, you can never go back to the previous question. That's why it's called unfolding. All right, it unfolds until you come up with the diagnosis, and then you implement, and then you evaluate your, your outcomes. You evaluate your implementation. Okay, so without further ado, we're gonna listen to Paula, one of my colleagues here in Texas. She's really an expert on your answering case studies. So we are going to, or she's gonna answer an example of an unfolding case study, which has a 6 part. And along the way, we are going to rationalize, not really, talking about the content, about a certain condition, but in terms of how she answers it. By we're gonna evaluate it. At the same time, Jamie will come in order for us to understand what is really about, answering these case study questions. Okay, so Paula, take it away.
Hello, good morning to all. My name is Paula. I'm also one of the educators here in IPASS. So I would like to present to you a case study that we will be answering today. So help me as I go along, okay? All right. So, if you're the student reading this question and you're going to be going through your NCLEX exam with an NGN format, I would like you to, of course, take a deep breath first and then imagine yourself that you are the nurse, you are the primary nurse taking care of this patient. Okay. So, in the practice of nursing here in the US, so here we are trained on how to read the charts. Okay, so that's why in NGN case study you have noticed that they have put narratives. No, they have put the patient. Okay, what's the complaint about, and what is the presentation. So first things first, I want you to imagine yourself that you are in this scenario and you are taking care of this patient, and you have to really take it seriously. Okay, so first is this is a recognizing cues. Okay, which is part 1 of 6. Okay. So the nurse takes care of a 60-year-old male admitted to the emergency department with chest pain. So another thing, I want you to be time sensitive. What do I mean? You have to read first the narrative on the left hand side. So you have to look at the time. Okay, what time it started. Okay, because as you go along the story, the time will also evolve. Okay, the story will also evolve per se. Okay, so this 60-year-old male is admitted to the ED with crushing sternal chest pain that is radiating to the left arm that is worse with walking. Pain began 2 hours ago while walking outside. The client also reports of shortness of breath or SOB with activity. He reports that he is taking regular aspirin on the way to the hospital. Okay, vital signs as follows. Your temperature is 99 Fahrenheit. Your heart rate is kind of tachycardic. He's 110. His respiration's 22. His blood pressure's 160 over 90. His O2 sats 93 on a room air. Okay. His chest pain is rated as 8 out of 10. His weight reported at 280 pounds or 127 kilograms. I'm thinking of him being a kind of overweight, right? Okay, so he started now on chest pain protocol. So the chest pain protocol, if you're the student taking this exam, so you have an idea that the chest pain protocol starts with your what? It's like your aspirin, your Mona, and all that, right? Okay, so yeah, that's why they gave the O2, they gave the nitroglycerin. They started with the IV, okay, that is placed to the left AC or your anticupidal. Morphine is now given, and the labs were drawn. Okay, so thinking about this, what is the chest pain protocol? So that's basically your MONA stuff. So typically, class, before the patient comes to the ER, usually before they're being picked up by the EMS or the ambulance, they typically are given with 4 tabs of aspirin, or they call it rather the baby aspirins. So it's an 80 milligram tablets, 4 pieces, before they go to the ER. Okay, usually when they start complaining of this chest pain. Okay, and also, of course, they take the vital signs, so which is being presented to you right now. So you're thinking, oh, temperature's okay, right? Okay, heart rate is kind of tachycardic. Obviously, his RR will also try to compensate. That's why he's trying to breathe faster. And his blood pressure is 160 over 90. I have a lot of things that I'm thinking right now. So I'm thinking probably this patient is also hypertensive in nature. Okay. So, and also his autosat is 93. That talks about him being having shortness of breath. Okay. But right now, do you think that 93 is already critical? If you're the student taking this exam, is this already critical? Knowing that he's on a room air. I need answers from our students tonight. Okay, what do you think, class? So, do you think this is kind of critical? For me, not yet. Okay, because as long as it's greater than 92% on a room air, but rather when you this kind of patient goes to the ER, looking at the protocol, they started him already on O2. That's why you see there O2 is applied. So there's doing something about it. Okay, so the ER nurse is doing something about this patient. Okay, so next slide, please. And the labs that they're talking about is basically your CBC or CMP cardiac markers. Usually the doctors will start ordering for the cardiac markers now. So looking at your laboratory, okay. So look at here. Probably he's also having hyperlipidemia that talks about his cholesterol levels. His white blood cell count goes up as well. Okay. Typically, class, people with chest pain, okay, they typically have elevated WBC count. Why? It's probably due to reduced epicardial blood flow and your myocardial if perfusion is already affected. Okay, that's why the WBC goes up. Okay, your platelets is within range. So as you see, class, even in your NGN, you all know that the reference range will be shown there. Okay, it's just that you have to know by nature, how can I execute this? You should have the knowledge on why these labs were drawn. Okay, and you will associate that with a certain condition of your patient is having. Okay, potassium, that's your electrolyte, it's 3.9, so it's within range. Okay, your sodium level is also within range, which is 140. It's not critical, so it's good. Your magnesium is also normal, it's 1.5. Your troponin, however, look at this one. Why is troponin and your CKMB being shown here? So you already have an idea. Okay, looks like we're talking about an ACS problem here. Okay, so usually, class, even in your engine, they will give you the hint already. Why is this significant laboratory being shown here? Why did they put CKMB tropes? So you have an idea already. If you know the basics of your ACS, you know that CKMB and tropes and your CMP rather is very important when it comes to trying to rule out your ACS. Okay, so I think there's another slide probably here. Okay, also going back. So now you're being asked, okay, the nurse reviews the diagnostic and laboratory findings. So which two findings are most significant? All of them are important, okay? I didn't say that, oh, it's fine, just let it pass, okay? But you're being asked which two finding is very, very significant. If you're a nurse taking care of a probable ACS, okay, what do you think is very significant here? And that is none other than your EKG and your what else? Your troponin. Why? Because, class, your troponin is the most sensitive determinant of your ACS. And your EKG also will tell you, okay? It will help you determine, okay, if there's like STEMI or NSTEMI. All right? So I just want to make it basic for now. So it will help us determine if the patient is having a STEMI. Okay? All right. Moving forward. So Mom Jamie will help us with the recognizing cue strategy. Over to you, Mom Jamie.
All right. Thank you, Miss Pao. Hey, everybody. Hello, everyone. Hello to my fellow nurses all over the world. I'm Jamie Robbins. So, I am presenting to you guys the 6 clinical judgment skills or the six clinical judgment that we can use in solving our NGN or new generation NCLEX questions, which are case studies. So do not fear the case studies because they are really easy to understand. But if you are also able to know your basic information regarding your pathophysiology, this will really help you a lot. So, as presented by Miss Paula, we have the case study 1 and 2, which was supposedly this is the recognizing cues. And what is about recognizing cues? So, the recognizing cues, this is where the examinee needs to identify the significant relevant data related to the disease condition. So, understanding the concept is the best foundation, but there is a cue on how to answer this question. So number one, you must be able to answer yourself, to ask yourself rather, what matters most. So what matters most in this situation? So as provided in the case study, you have your the history, the patient's history. You have all the lab values needed. You have the time, which is very important. And also the medications will be also provided in that case if you are answering your questions. But as we go along, you will see a lot more. And the most important thing is for us to know what is happening in my patient right now. What is the very most important thing that I must need to address? So as the labs was presented earlier, you are asked to find two most important things. So being the nurse, you are also able to know, oh, ECG is important in this matter. My troponin is a little bit increased. So what comes into your mind? So that is how you recognize cues. Only look at the relevant data, which will help you answer and analyze the problem being presented in your situation. So as nurses, you know that we are problem solvers. So as you go to work, as you go to your testing or to your NCLEX, you are already solving problems. So these are the one we are supposed to see during your examination and even in your clinical practice as well. And for the next one, Miss Paula will be back to present to you the next case.
Hello again. So we are now on item 2 out of 6 to analyze the cues now. All right. So still, we're taking care of the same old guy, 60-year-old male admitted to the emergency department with chest pain. So like I said, be time sensitive. So we're being shown with the same narrative here that started at 10 a.m., okay, which is the 60-year-old male admitted to the ER with the crushing sternal chest pain radiating to the left arm that is worse with walking. Okay, so you're still being shown here the BMI, the laboratories, the vital signs of your patient, what happened on the way to the hospital, and the MONA. Okay, so on the right hand side, you can see here for each client finding, click to specify whether the finding is consistent with ST elevation, MI, or is it NSTEMI or unstable angina. So each finding may be consistent with more than one condition. Okay, each column must have at least one option selected. So like I said, class, we have to determine what is unstable angina first and your NSTEMI and your STEMI. So basically, class, with your NSTEMI, you have to figure it out first. Okay, with your NSTEMI and STEMI, basically that talks about the outcome of your EKG. Okay, so ST elevation MI that is being reflected on the EKG, like I said. Okay, so and STEMI, it means like non-ST. Non, it means it might be absent or it may later be present, but basically it's absence of ST elevation MI. Unstable angina happens with what? It happens during exertion, okay, when you're doing your exercise and you have this crushing crushing chest pain. But let me tell you, if you have an unstable angina, that may not reflect on your EKG yet. Okay, they might not even reflect on your troponins. Okay, so if it's really significant occlusion that's going on with your coronary arteries, then that will really reflect with an STEMI. Okay, or STEMI. Okay, so I hope you're following me with this one. Okay, so anyway, so first things first, CKMB. I need answers here on board. So what do you think, class? Does it exist with your NSTEMI and your STEMI? Yes, it does. So CKMB also what? So we're putting a check on your STEMI and your and STEMI. So it does what? It does elevate during your chest pain periods, okay? Crushing chest pain, it does exist with the three of them. Like I said, with your unstable angina, after did your exercise, after you got stressed with work and all that, then that happens. You have that crushing chest pain, okay? All right, how about your EKG changes? Your EKG changes, obviously, that is reflected with your STEMI, all right? But with your and STEMI as well, okay, does it reflect? It doesn't, okay? Because why? Like the word itself, you have a clue already, non-ST elevation MI. So obviously with your unstable angina, it will not reflect yet, okay? But with your elevated cholesterol or HLDs, okay, you will see that with your labs, right? Okay, that is being reflected. So obviously this guy has one, two, okay? So on three of them, yes, you will see that going up with your STEMI and your unstable angina. With your obesity, which this guy has, so obviously he is 127 kilograms or 280 pounds. So in general class, not to judge, but typically class, they come in with STEMI and unstable angina too. Okay, that really exists. But with your troponins class, like I said, it goes up with your both of your STEMI and your and STEMI. But with your unstable angina, it will not reflect yet. All right. So that's why, class, when you have unstable angina, they go to the clinic. They try to tell the doctor, hey, 2 days ago I have had this crushing chest pain. I just want to get checked. Okay. So the doctor will still have to do a lot of series of investigations like stress test, echo, and all that to really determine what's going on with the patient. But upon coming to the ER, the CKMB, EKG changes, troponins may not give you an answer yet. Am I clear? I hope I am. All right, so Mom Jamie will be helping us with the strategies on how to analyze the cues. Thank you, Mom Jamie. Go ahead.
All right, thank you again, Miss Paula. So, guys, the second one will be analyzing cues. So, what does analyzing cues mean? So, the examinee needs to connect the data to the client's presentation or clinical presentation provided, and then determine whether the data are expected or unexpected and what the data means. So, you have to analyze in this part. And then the chronic symptoms of the patient is also shown in the history. So, organizing and linking each symptoms all together, so you have the idea my patient is having based from the presentation or from the based from the history provided earlier, so you already have the idea what your patient is having. So that is number one. And then what does it mean? So you have to find out the abnormal findings. Does it fits together to the like a bigger picture if you connect them all together? And then consider the patient is having this real problem, so you were able to identify earlier STEMI or is it an unstable angina. So you determine the patterns and then you connect the cues and also decide if information you are provided is enough or you are needing more. So just link the data you have earlier. All right, Miss Paula, back to you.
Some strategies on how to attack the item 2 out of 6. Okay, now we're headed towards our prioritizing the hypothesis. So now, okay, you're thinking of, okay, this really looks like a legit ACS. Okay, so if you have an idea, or like I said, if you have a strong idea or knowledge about the management of ACS, you will be able to answer this question. Okay, so first, same old 10 a.m. 60-year-old patient, same presentation here, but you are being asked to answer this drop down. Okay, so don't be intimidated with this. Okay, so you're thinking of STEMI. I'm pretty sure this is STEMI. Okay, so that's why your answer here is that the nurse should recognize that the client is most likely experiencing a STEMI or the ST elevation MI. Okay, so with discussing the STEMI or the ST elevation MI, usually class, this is caused by coronary artery what? So let me tell you something a little bit about rupture. So a rupture, usually you will see or you will hear this with your cardiologist. They will say, "Oh, I'm thinking of a probable rupture or dissection. Okay, usually class dissection, this happens if your patient has what, cardiac tamponade or cardiogenic shock. Okay, this is worse than, probably likely this is worse than your MI per se. Okay, if you're thinking of a rupture, okay, that's worse. So that is not likely happening with your patient right now, since we don't have any presentation that talks about cardiac tamponade or cardiogenic shock that's happening with your patient, right? So if I'm the student, I will take that off my list, okay? Spasm class. Coronary artery spasm happens when your patient gets exposed to cold, he is using cocaine or amphetamine, he does a lot of cigarette smoking, or he's on high stress situations. But the kind of pain that they will complain of is different from what this patient has. So what are you left with? So you're left with coronary artery blockage. All right. So back to you, Mom Jamie, to help us with how to attack the prioritizing hypothesis question. Thank you, ma'am.
All right. Thank you again, Miss Paula. So number three, guys, we're down to number three. So this is prioritizing hypothesis. So before I begin with the explanation, so I just wanted to remind you again that if you click next, you cannot go back to the first one. So you must be able to know and understand the scenario very carefully, read the situation very carefully, and also you have to imagine that you are the nurse taking care of this patient. So that's how you can answer effectively and know your you can apply your clinical judgment skills in this. So prioritizing hypothesis, so what is this? This is your needs, or this is like rank your hypothesis or your client's problems, and then you determine the concerns or the client needs and their priority, and you analyze. So what is the question to guide your decision making? So ask yourself, where do I start? Okay, and then in this you must be able to know what are the problems being presented by your patient. Am I prioritizing my airway? Is there any airway difficulty presented? But my auto saturation is 93 on room air, so the patient is doing fine. How about the pain? How about the pain scale? Is it 10 over 10 or is it 3 over 10? So you must be able to identify which one. Also, so you have to know also the difficulty of breathing is also one that we need to address during this kind of scenario. So airway is most often always the priority. However, the conditions may change dramatically. So we were used to say if the airway is the problem, we always answer letter A, on which is the airway, but it doesn't supposed to be that way. You have to really analyze, because if you're there is a neurological problem or neurological alteration with the patient, that will be your priority. Okay, and then what else should we do in prioritizing hypothesis? So from the evidence base given to you earlier, and then you have to combine and cluster the information, and also focus on the possibilities. This is where your decision on prioritizing which one is the most now needed to be addressed at this moment. So what does my patient need at this very moment? So that is where you prioritize your hypothesis and ask yourself, where do I start in this situation? All right, back to you, Miss Paula.
Sorry about that. So, thank you so much once again, Mom Jamie. So, we're now on the item 4 out of 6 to generate solutions. So, generating solutions class, typically, you will be asked to determine if your nursing interventions are truly indicated or not with this patient, right? So, in that regard, like I said, a strong clinical an analysis and your knowledge of management of ACS is really essential to attack this question. Okay, so in that regard, usually you will be asked with medications. Okay, is this medication indicated or not? Or you will also be asked about interventions. Okay, is this action good or not? Okay, so here, same thing. The nurse cares for that 60-year-old client at 10 a.m. So there are no changes that I've seen here. Is there a next slide after this one? Okay, ano, yeah. So the same old one. Okay. So now, okay, the client receives a diagnosis of ST elevation MI. For each potential medication order, click to specify whether the medication is indicated or not to include in the plan of care. So, analgesics. Analgesics is covering what? What do you think? I need answers from students. Thank you so much once again for participating with our live session. So, what do you think, okay, are under your analgesics? Does it cover your morphine, fentanyl? In terms of chest pain, do you think that is included under the category of your analgesics? Yes or no? I need answers from students. Let me see. Yes or no? I bet they are. Yes, they are. No, they are under the analgesics. Okay, so in that regard, we really have to address the chest pain being what? Being verbalized by your patient to you. Okay. Next is antibiotics. Is this indicated at this moment? Is your patient having any signs of infection? Look, just looking at the WBC, just looking at the client's presentation, do you think he has some sort of antibiotics? No, I will exclude that from my management. Okay, so that will kind of be, I mean, for me, if I'm gonna be the nurse, I would be questionable, okay, with in terms of giving this patient an antibiotic because it is not necessary at this point. Okay, how about your anticoags? Do we need an anticoags for this patient? Definitely, class. We need the anticoags for your client. Okay, how about your beta blockers? So your beta blockers talks about your heart rate being 110. So we typically give them what? The oral drugs like your metoprolol. Because why? So not only class, your patient's heart rate will be addressed with the help of your beta blockers, but also class, remember your beta blockers also helps with what? Preventing arrhythmias, especially that if your patient's having some ventricular arrhythmias, okay, which is this is the quite common cause of death with your ACS clients, okay? And controlling the BP is just secondary when it comes to giving your beta blockers. So per se, I will give that or I will put a check on that indicated under your beta blockers. Next is fluid bolus. Is that necessary at this point? Is it necessary? Just looking at his blood pressure, looking at his presentation, do you think that's necessary? The answer is what? The answer is not indicated. Okay? All right. So, next. Okay, this is the gold standard and this is the number one management when it comes to trying to rule out STEMI, okay, especially if we've seen STEMI, elevated troponin markers with your clients, the doctor will automatically order for a heart cath, which is being done in the cath lab class. So what is a heart cath? So a heart cath procedure class is where the doctor, okay, injects a contrast or media, okay, on your patient, okay, to check where the occlusion is happening from the coronary artery. So they will be able to determine where is the location. Is it on the left anterior descending artery? Is it on the left main? Okay, or is it on the RCA? Okay, so the doctor will guide him with the heart cath. And right there and then, they will be able to determine if the patient is what? Okay, is a good candidate for heart stents, or otherwise the patient will be a candidate instead for what you hear about or seen is cabbage, okay, or your coronary artery bypass graft. Okay, and other management are also being performed in your heart cath, like the left heart cath, right heart cath, and other managements. Okay, so back to you, Mom Jamie, on with helping us on how to um, strategize generating solutions. Thank you so much, ma'am.
All right, thank you again, Miss Paula. So, guys, we're down to number four, which is generating solutions. Okay, so generating solutions is one of my favorite because in this, we need to use the hypothesis to determine interventions for an expected outcome, which is the planning part. So, it is very important for us as nurses to understand the pathophysiology, to understand the expected management of both medical and nursing. So, as foreign nurses, do we have always encountered questions? Do we really need to study the pathophysiology? And I am saying this, yes, we have to. Because here in the US, there are a lot of cases which we do not encounter in our country, and we have to really relearn all those things. So, the case nowadays, the patient that was like 20 years ago who are in ICU unit, we are already taking care of them on the floors, like regular ward or units. So because of the technological advancement. So we should be able to be equipped with knowledge, and then also our clinical judgment will be supposed practice and learn a lot more. Okay. And then in here, in generating solutions, so what is the task of us being nurses? So the guide for us is to ask ourselves, what can I do in this situation? So in here, in number 4, we are going to develop the plan of care. So as presented earlier by Miss Paula, there were interventions that we need to provide. It is asking us is we can give pain management, which is also needed or indicated in this situation. Asking number 2 was antibiotics, but there is no fever, there is no infection signs in this situation, so we do not give the antibiotics. And then number 3, we have the anticoagulants and then the beta blockers to manage the blood pressure. Yes, that is very highly needed and recommended. And number, what was the next one? Fluids. No, guys, we are not giving fluids because we are not overloading this patient. And also, the blood pressure is really high. So we don't have to give fluids, I mean, like bolus. Also, number 4 is our part of our number 4 is generating the surgical intervention. If all the medical interventions are provided and we are not improving, so we go ahead to the next plan. As I've said earlier, nursing intervention and medical intervention here in the US is very invasive, and we are always ahead of saving our patients' life. So we are, as foreign nurses, we should be able to keep up with these changes. But I'm pretty sure we all can taking strategies. We are to help ourselves analyze more the situations being provided in this situation, and then identify your risk factor, what is causing this worsening symptoms of our patient. All right, so that's all for our generating solutions, and will be down to number 5 and 6 later. Thank you. Miss Paula, go ahead.
Much once again, Mom Jamie. So we're almost at the last leg of this presentation. So item 5 of 6. Now we are now taking actions. Okay. So the nurse cares for that 60-year-old male admitted to the emergency department with chest pain. So as you've seen on the left hand side, you've seen some changes here. So that's why, class, when if you're gonna be taking your exam, please keep looking at the left hand side. Be time sensitive. Look at the details. Okay, and try to remember, okay, what was the changes from 10 a.m. moving forward? Okay, so looking at the medications, you've seen here that he will be taking, or he is getting some Lovenox, or what we call the enoxaparin. So usually, class, the enoxaparin, that medication is given subcutaneously on the abdomen. Okay, so that helps prevent blood clots from forming. Okay, so that's why I typically tell my patients whenever I'm giving them the what we call the belly shots. Okay, next is your metoprolol. Okay, so like I said, the metoprolol in this case scenario will help lower his heart rate. Okay, and also will secondarily control the blood pressure of my client. Next is the morphine sulfate, which is 2 milligrams IVQ 6 hours PRN for chest pain. Okay, which I will be giving afterwards. Okay, and now the procedure is indeed heart cath. Okay, so on the right hand side, you're seeing here the nurse should next give or implement what? So the priority amongst the four of them is what? Your priority will always be your heart cath, nothing else. Okay, that's gonna be your priority to rule out that STEMI. Okay, which should be given what? Okay, it should be with urgency, class. Okay, by the time that they have determined, or they have found out the elevation in in your troponins, ST segment elevation MI seen on the on the AKG right away. Okay, the doctor will do a heart cath. He will call the on-call cath lab team. If they're not around, they will call it. It should be stat. Okay, it should be stat upon admission. Okay, you cannot wait for this. You cannot delay this one. All right. So, Mom Jamie once again will help us with the taking actions for this patient.
All right, thank you again, Miss Paula. So, guys, we're down to number 4, and one more left is where we take actions, we implement all that stuff. So, there is a need to implement the generated solutions addressing the highest prioritizing or the priorities or hypothesis, which is implementation. And once more, airway is more often always the priority. However, it can change and dramatically, and we also have to depend on the situation if we are going to prioritize the airway. So in here, we have to implement the solution. So what are those? Earlier was provided we are giving medications. We have the Lovinox, we have the metoprolol and the morphine sulfate for pain management. And also, we are going to do the surgical intervention. So time is very crucial at this moment. And then from the history of the patient, there is a significant blockage, and then the patient is also obese, and then we are also having the ST elevation. So we are really going to do the heart catheterization. And then your nursing start acting with your plan. So this is where we implement. And what are those? So we perform all the skills and procedures. We have the medications. We have to administer the medications and collaborate with healthcare team. Of course, you have to what? Do the pre-op and all that stuff. But this is emergent, so we are going to do this in as fast as we could, as fast as we can. And then we do the health teaching as well, and we all send, so that is also should be done. And also we practice the ethical and legal behaviors in this time. Are we needing blood transfusion, let's say, for example? But I don't think we will, but in this case we also have to consider it depends on your situation. Okay. And then so we are also communicating or collaborating with the other hospital resources if we are also needing them. All right, so that is our number 5. Miss Paula, we're down to number 6. Go ahead, please.
Okay, we're now at the very last, which is evaluating outcomes, which is the item 6 out of 6. So the nurse cares for the 60-year-old patient. So if you've seen here, class, like I said, like I keep reminding you, be time sensitive. Look at the 10 a.m. entry versus the 10:40 a.m. going forward down to your 12:1500. So if you've seen here, class, looking at the top, okay, so 10:40, that's the time that they did the heart cath. Okay, at 11:50, that's the time they did the PCI, or the percutaneous coronary intervention, whereas the doctor has placed two stents. Okay, but they didn't specify which part. Okay, they which part of the coronary arteries the doctor has placed, or the interventionist has placed the two stents. Okay, but I want you to take note of the vitals from the 10 a.m. down to your 12:1500. Okay, because on the right hand side, you are being asked, okay, to what? To compare your 10 a.m. down to your 12:1500 vital signs, because we have to know if the patient is declining, is it unchanged, or is it improving in terms of their vital signs. Okay, so here, looking at the pulse, let's start to check the pulse here. The pulse initially at 10 a.m. was 110. Looks like your metoprolol worked its action. Okay, so now at 12:15, look at this one. It's 98. So it is improving. Looking at the blood pressure as well, it's 160 over 90. After the procedure, it went down a little bit to 133 over 80. Okay, so for me, that is what? Improving. On the autosat level, however, you've seen there what? 93% on room air. So it's still 93% on room air at 12:15. But don't fret. For me, it's unchanged. But it's fine though. Give it some time. Your patient's still trying to recover from the heart cath procedure. Okay. Respirations. Look at this one at 10 a.m. It tells you that it's what? It tells us that it was 22. And now it's what? Respiration. Do we see any respiration? It's 20. Okay, for me, that is also improving. For your chest pain level, initially that was 8 out of 10. At 12:15, you see there you go, it's 0. So looks like the heart stents really have helped with resolving the pain issues of this patient, since they located already the source of the occlusion, and they managed it with the heart stent. So there you go, it's improving. So anyway, thank you so much for helping me with answering this 1 to 6 part question of your NGN. So Mom Jamie once again will help us with evaluating outcome strategy. Go ahead, Mom Jamie.
All right, guys. Yes, and now we're down to number 6, which is evaluate your outcomes. So the candidate needs to compare observed outcomes with expected ones and ask yourself, did it help? Did my plan of care work? So you have to evaluate the pain score, the presence of, is there any presence of difficulty of breathing, or is it resolved? Is the my patient wean from oxygen if he was using oxygen, or if he was still on room air? And then also your vital signs shows earlier that the patient was already improved. So that is a good sign that the plan of care that we have provided improve and help the patient recover from his situation. So also, the nursing task is also to ask yourself and see from the situation: is my patient getting worse? Is any of my action didn't help? But in this case studies, guys, this is very fun to answer because it leads you to where you should be. So your judgment is very important from the beginning. So you really have to determine what your situation is asking you and put yourself in the situation. And then do not add or eliminate anything from the situation. What you see is what you get. Okay, so remember that. And do not think of what if, do not overthink, and do not overanalyze as well. Okay, so that is also another technique that we are going to use in your NCLEX, especially with your case study. So your world has provided us with a lot of case studies. There are very good sample questions that you can provide. As in IPASS, guys, we have developed this thinking strategies book that we are using, and our students are also provided with lectures about this. And for the next general strategies for case studies, we are going to have Sir Jay. Back to you, Sir Jay. Thank you, guys.
Thank you, Jamie and Paula. That was a good, the way Paula answers it. Of course, her knowledge. She's actually our NGN expert. She does the drills. I do the, concepts about cardio, and Jamie's also doing the test taking strategies. And so, as with the other educators in IPASS, they also do some drills, especially in your next generation NCLEX. Now we're down to your general strategies for case studies. Principle over facts. It's okay to to memorize mnemonics. For example, the monabash, the morphine, the oxygen, the nitro, the aspirin, anticoagulants, antiplatelets, the aspirin, and those stuff. It's okay to memorize those, but what's more important is the principle behind why are you giving this morphine, why are you giving this kinds of medications. Okay, so it's very important. All right, so principle over facts. It's gonna help you, your mnemonics can help you, but it's a lot better when you understand the principles. Whatever the questions they're gonna ask you, okay, whatever questions they're gonna ask you, you are going to make it because you understand the principles behind it. Concept building is very important. All right, so remember this, this NCLEX is a nursing knowledge kind of test. So nursing knowledge is needed to assist you in answering test questions because knowledge provides information that you need to think about critically. It's about connecting the dots as well. Everything is like, connected to each other. Like I said, understanding. We're emphasizing on that one. Understanding your pathophysiology is really, really important because everything will follow. You know the symptoms, you know the diagnostic examinations, you know this, interventions, you know how to take care of your patients overall. Okay, so yeah, so a safe nurse with clinical decision making or clinical judgment knows how to connect the dots, and those dots, okay, are backed up with knowledge. If you notice, if Paula doesn't understand, the spectrum of acute coronary syndrome, the ST elevation MI as the severe, the most severe type of it, if she doesn't understand the difference between non-STEMI and STEMI, unstable angina or stable angina, she may not be able to, answer it well. Okay, so you have to be really careful about your knowledge on answering these questions, and these are backed up with knowledge. Okay, so is there any way to develop your knowledge in a very small amount of time? Definitely yes. Okay, so the answer is big yes. It's another big yes. Guys, I go without a plan remains to be just a dream. You have to plan well because NCLEX is very challenging. Okay, so though it's challenging, but you will be able to do it. Period. Whenever some people will tell, okay, you cannot do it, or even yourself is telling your own self that you cannot do it, no, you can do it. As long as you have the goal, as long as you have the dream to make it, you are going to make it. Okay, so how are you going to do it? How are you going to build it then? Practice, practice, practice. Okay, so this is talking about repetition to improve your retention. The next day it's gonna wane off. The knowledge that we are going to tell you, for example, like the past few days of lectures about, especially in your cardiology, those are big topics. On the next day it's gonna wane off. Okay, or let's say if you're kind of like you're more intelligent than the others, I wouldn't think so because you're all the same for me. Okay, so if you have a good memory, but well, you are not perfect, it's gonna wane off probably like after a few days. Okay, so you have to practice, practice, practice. That's that's mastery of the topic. Okay, so master of the conditions from the assessment to down to your evaluation, especially answering your in answering your next generation NCLEX, unfolding case studies, or whatever questions they will ask you. Understanding the concepts like I told you. So practice similar, to NCLEX test samples. For example, like UWorld. Personally, I got UWorld before while preparing for the NCLEX because I was kind of really impressed with the rationale. I'm into rationale. I'm going to answer, for example, like 150 questions or let's say 75 item questions. I'm going to answer it in a period, for example, like 1 to 2 hours. But in terms of rationalizing it, understanding the rationalization coming from your world, for example, I'm going to be able to like read it wholeheartedly for a period, for example, like 4 hours. If I don't understand it, I need to get another reference to really understand it. But your world is already there. They have the videos, they have all the text, to understand it better in terms of understanding the concepts. All right, that's why I really love your world, and we recommend it to our students definitely. So you can do it mindset. Always know your deepest why. That's your motivation. Why are you taking this NCLEX? For us international nurses, you know why? I mean, you know what? It's kind of hard for us because it's really a struggle back in our country. But if I was able to make it here, I was able to make it through your NCLEX, you are also going to make it. It's just a matter of time. Okay, so there's nothing difference between me and you, Rachel, and every one of us in IPASS. And to those passers as well, there's no difference between us and you guys. You are going to make it. Okay, so persistence is the key. In not only that, it's also your consistency. You have to be consistent with your planning. You have to be consistent with what you are doing. For example, like cardiology, I'm tired. I'm not gonna study about neuro because I'm really good in neuro. Okay, and you started it. Okay, so please continue to study about neuro until you really get the core, knowledge about neurology or cardiology, whatever topics. Okay, so persistent enough is not enough. Okay, so apply your learning style, be creative. If you want to do mnemonics, that's fine. Utilize the best resources available. That's your world. Okay, so logic versus emotions. Anxiety management is very important on our program. We have the lectures. I do education just like Paula and Jamie, and so as with the other educators. But we do have another entity which is mentoring. That's why if you see our program, IPASS Online Review, which are the lectures, and Mentoring Academy. Mentoring Academy are the coaches that will assist you, along the way during your preparation. It will limit your anxiety, especially when you sit your exam. Okay, it will help your anxiety. Okay, because they are there to reach you out, to coach you if you have anything, any problems or issues during your preparation. It's gonna be a challenge, but again, it's very doable. And lastly, your spirituality. Okay, everything is useless without your faith that you are going to make it. I started it with your concept of manifesting. With your faith, you can manifest, you will claim, and you will be able to make it. With the strong spirituality that you have, you did your best, do it intentionally, okay? Do it intentionally, and you will be able to make it. All right? So, if this is not your phase during your preparation, your dreams are not big enough. NCLEX dream or coming here to the US is big. Again, if this is not your phase during your preparation, it's challenging. Your dreams are not big enough. Okay, so the feeling while preparing your NCLEX, it's challenging, but you can make it. Very doable. And you know what? This is the feeling when you pass the NCLEX. This is exactly the phase of me, myself, Rachel, and the rest of the presenters here. And everyone can relate to this. Once you get your NCSBN result and stating letter PASS, pass result, there you go. It's all worth it because you worked hard for it. You did your best in doing your NCLEX, especially during your preparation. And this is not something about yourself. Sometimes along the way you cry, but crying is an act of being selfless, especially to your family. Those are your deepest why you are taking this NCLEX. We are going to make it. Okay. So thank you for listening. I guess I'll have to uh, yeah, Rach, take it away. Thank you for listening. Thank you for our friends that are here right now, very participative. Mar, and I cannot, shout out all your names. And I'm really thankful and grateful that you are all here to be with us. Okay, so there you go. So take it away, Rach.
Yes, Jay, thank you very much to our educators, to all our coaches out there, to you all especially. Thank you for this opportunity, and to all our live viewers, may it be via our Facebook live discussion in YouTube, in UWorld Nursing, and as well as the YouTube channel of UWorld Nursing. Thank you very much for your participation. I know that you enjoyed a lot on this discussion because you were very participative on our session. So if you are guys in need of a comprehensive review program for your concepts, we can deliver it to you via the IPASS on Review and Mentoring Academy. And definitely for your next generation NCLEX Q Bank, without a doubt, get the subscription of a UWorld because that is the best that you can find out there. So you can visit our website at www.ipassprocessing.com, and also check the website of UWorld. That's www.uworld.com, and get their subscription the moment that you can already have your funds for your preparation. So thank you very much for your time to all our international nurses out there. Thank you very much. And we hope that we provided value for the time that you shared with us on this discussion. Thank you, everyone. And God bless everyone. We know that you can do it. Let's all claim it. You will all make it.